Hello, I'm Austin Rehl with Family Tree Dental. Today I have the privilege of meeting with my friend and colleague, Dr. Rick Newhart, who is the only periodontist in the Mid-Ohio Valley. Welcome. It's good to have you here with us today.
Thank you. Thank you for inviting me. I'm very honored to be here today. Thank you.
Absolutely. So I wanted to talk with you. Traditionally, people who have suffered from periodontal disease or tooth problems, they may end up looking at a traditional denture. But there's this term hybrid denture. Tell me what you know about it.
I don't prefer that term actually because I prefer fixed implant bridge work instead of that because a hybrid denture implies you take it in and out like a regular denture. And many people hate that. They hate using goo and they hate using all kinds of stuff like that and they can't feel the top of their mouth with their tongue. But a fixed implant bridge is something that stays in place. We're placed by us dentists. It's like having their natural teeth back. And they can take their tongue and touch the top of their mouth. Pizza doesn't stick to the top of their mouth. Like it's more like bridge work than anything
Wonderful.
else.
So, if you were to just say the three best things about fixed implant bridge work or a hybrid denture, what are the top three things? You mentioned a couple, but what would you say are the top
The
three?
top thing is we can give someone a fixed implant bridge in one day. Actually, in about 4 to 5 hours, we can take out horrible, hopeless teeth that are ugly and infected and put in sterile implants, lock them into the bone, and give them a beautiful bridge. And they walk out the door with beautiful bridge work.
Wow.
That's number one. Number two is a lack of significant pain. People are like always worried about so much pain. Most of the patients I have, almost all of them, it's very rare for anyone to report pain. Okay, that's very well controlled for sure. The next thing is what we're able to achieve in aesthetics and beauty because we can totally control their teeth whiteness, color, shape
Wow.
that you could never do with trying to keep their teeth if they're hopeless.
Right. Yeah. That sounds like some distinct advantages. Tell me a little bit about the cost. What should a patient expect when it comes to the cost of a procedure like this?
The cost of this procedure is about like that of a new car. Okay, but it doesn't depreciate. If you take your car and you drive it off the lot, boom, you've lost $5,000. And every year that car is going to depreciate until it's worth nothing and you have to repeat the process. Hopefully with this fixed implant bridge work, once you pay this, hopefully it's going to be good for a very long time. Maybe for the rest of your entire life.
Right.
And no one can say that necessarily about a car.
Yeah, it's not insignificant in cost, but I like to say as we age, there are a lot of things that we can't do, but enjoying our food and smiling and communicating ought to be one of them.
Dr. Real, I agree 100%. Is you're always, no matter how old you are, you're going to want to smile. If you're with your kids, grandkids, you want to look good. Look good in the photographs for the grandkids and stuff like that. Chew, eat, and be with your friends and enjoy your teeth.
Wonderful. So tell me about the process from considering this procedure to having it done. What appointments would a patient expect to have?
First, they would see you at Family Tree, and they would probably say, Doc, I'm ready to give up on my teeth. They're ugly. I hate them. There's a lot of infection there. Let's just pull those teeth. And you would say, wait, before you do that, let's see if there's a better way, which is fixed implant bridge work. And then you would send them in for a free implant screening at my office, which it doesn't cost anything. I'll talk to them about the costs and risks and benefits. After that, I do a high-tech CAT scan, a high-tech computer scan of their mouth. I look at that myself. I send it off to a specialized digital planner and make sure there's enough bone for actually to do the procedure. Once there's enough bone, I meet with the patient, say, good news, there's enough bone. Or sometimes say, bad news, there's not. But most of the time we say, yes, there's enough bone, we can do this. Then I contact you and say, we can do this procedure. Let's go for it. Then we make up a special surgery guide, a special bridge to go in that same day. They come in, I take out the bad teeth, put the implants in, put the fixed bridge work in. I cover them, take care of them for about 3 months. After 3 months, they come back to your office and you start working with the fixed permanent bridge, which is made of zirconia, which is countertop material, very hard. So that's basically how it is in a nutshell.
And then they can smile, they can bite into an apple, they can enjoy corn on the cob.
They can do whatever they want.
Okay.
That's correct.
Wonderful.
And the advantage of this procedure also is that it's all done locally, as far as with your excellent team does the bridge work here. Okay. They don't have to travel to Cincinnati, Dayton, Columbus, Pittsburgh. You're taking care of them right here, and I'm taking them care also. So if they have a problem and they want someone to look at them, I'm here for them, and you're here for them too.
It's not a one and done like you might have with a national provider, with the local
That's correct.
professionals that they see your kids in sports. You're there for decades, for a generation.
Absolutely, to look after them and care for them. And they're almost kind of like family after a while. They're a special group of patients.
Yeah. Well, it's wonderful to hear what technology and creativity are how that's coming together in both, the durability and the artistry to give people the closest thing that they can have to a new teeth when they've gotten to the point where a decision has to be made.
Absolutely.
Thanks so much for joining us today. We really appreciate the time.
Thank you so much for inviting me. It's been an honor.
So if you're unhappy with your smile and you're considering traditional dentures, before you make a decision that's irreversible, come and talk with us. We'll see what opportunities are available for you.
Our dental team would love to answer your questions and provide the solutions you're looking for. Contact a Family Tree Dental near you.